if you've had a hysterectomy, this is what I'd recommend that you talk to your provider about on how to figure out where you are in this process, whether that be perimenopause and menopause. The most important things are your symptoms. Okay, I've said that over and over again, like just beating it down. Your symptoms are the most important, okay? But if you don't have somebody who totally understands the symptoms of this, you need to find somebody who does, to be honest. But you can ask your PCP to see if they'll simply do a few labs, and some labs that they will do is like an FSH and an estradiol. That's not the end-all be-all, but it can be helpful if your FSH is slightly elevated, because it can give us an idea, and even your PCP, even if they're not trained, that like something is off with your brain to ovary connection, that your brain is trying to pull estrogen and needs more FSH than normal to do so, okay? Your estrogen can be normal, but your FSH can be high, which can indicate a breakdown in that system, meaning that egg count is declining and your estrogen can be falling or fluctuating wildly. The anxiety here, though, is important to understand, is that the biggest thing for you to be a proponent for yourself is you've had a hysterectomy and you're having anxiety. That does not mean that you don't get to have progesterone. Estrogen can help with serotonin production and helps with anxiety, but we find that progesterone binds to GABA, which is a very calming neurotransmitter that can make you feel calm, helps with sleep, irritability, and anxiety. So, but they might not give it to you because you don't have a uterus, okay? But we find, a lot of women still like progesterone. So you don't really need to test your progesterone levels. I'm just going to assume that they're low. If your FSH is doing something funny, if it's elevated or your estrogen level is abnormal. But I would find somebody who understands the symptoms of menopause and will treat you despite labs. Even if your labs are normal, you still get treatment, and it would be considerate of adding in progesterone even though you've had a hysterectomy, because progesterone affects other areas of their body, not just the uterine lining, as far as protecting it against the unopposed estrogen. Helps with irritability, mood, sleep, anxiety, and your bones too. So it's not just for that uterine lining. So I hope that's helpful. But an FSH and estradiol, a total and free testosterone, and then also get your hormone, your thyroid rechecked too. But again, they can all be normal and you can still be treated. But that is hopefully helpful if you've had a hysterectomy.